हेलो फ्यूचर डॉक्टर्स। आज हम पढ़ेंगे चैप्टर नंबर 4 रिप्रोडक्टिव हेल्थ। मैं हूँ श्रेया और मैं आपको करा रही हूँ एनसीईआरटी रीडिंग। एनसीईआरटी रीडिंग में हम आगे फॉरवर्ड करेंगे। आज मैं नया चैप्टर शुरू कर रही हूँ जिसका है पार्ट 1। You have learned about human reproductive system and its function in chapter 3. Now let us discuss this closely related topic, reproductive health. What do we understand by this term? The term simply refers to healthy reproductive organ with the normal function. However, it has a broader perspective, include the emotional and the social aspect of the reproduction also. According to World Health Organization (WHO), reproductive health means a total well-being in all the aspects of the reproduction, that is physical, emotional, behavioral and the social. Therefore, a society is with the people having physically and the functionally normal reproductive organ, normal emotional and the behavioral interaction among them in all sex related aspects might be called reproductively healthy. Why it is significant to maintain reproductive health? What are the methods taken up to achieve it? Let us examine reproductive health problem and the strategies. India was among the first country in the world to initiate the action plan and program at the national level to attain the total reproductive health as a social goal. These programs called family planning were initiated 1951 and were periodically assisted over the past decade. Improved program covering wider reproduction related areas are currently in the operation under the popular name Reproductive and Child Health Care (RCH) program, creating awareness among people about the various reproduction related aspects, providing facilitate supporting for the building up a reproductively healthy society are the major tasks under these programs. With the help of audio, visual, and the printing media, governmental and the non-governmental agency have taken various steps to create awareness among the people about the reproduction related aspect. Parents, other close relatives, teachers, friends, and also have a major role in the dissemination of the above information. Introduction of sex education in school should also be encouraged to provide right information to the young so as to discourage the children from believing in myth and having misconception about the sex related aspect. Proper information about the reproductive organ, adolescent sex related change, safe and the hygienic sexual practice, sexually transmitted disease, STDs, AIDS, etc. would help people, especially those in adolescence age group, to lead reproductively healthy life, educating people, especially fertile couple and those in marriageable age group, about available birth control option, care of pregnant mother, postnatal care of the mother and the child, important of the breastfeeding, equal opportunity of the male and the female child, would address the important bringing up the social consequence, healthy family of the desired side, awareness of the problem due to control population growth, social evil like a sex abuse and the sex related crime need to be created to enable people to think, take up the necessary step to prevent them, thereby bringing up the socially responsible and healthy society. Successful implementation of the various action plan to attain the reproductive health required strong infrastructural facilities, professional expertise and the material support. These are the essential to provide medical assistance and care to people in the reproductive related problem like a pregnancy, delivery, STD, abortion, contraception, menstrual problem, infertility. Implementation to better technique and the new strategy for time to time and also required to provide more efficient care and the assistance to the people. Statutory ban or the amniocentesis for the sex determination to legally check increased menses for the female feticide. Massive child immunizations are the some program that merit mentioned into connection. In amniocentesis, some of the amniotic fluid of the developing fetus is taken to analysis the fetal cell and the dissolved substances. This procedure is used to test for the presence of certain genetic disorders such as Down syndrome, hemophilia, sickle cell anemia, and determine the survivability of the fetus. Research on the various reproduction related areas encourage and support by the governmental and non-governmental agency to find out new method and improve upon the existing one. Do you know that Saheli, a new oral contraceptive pill for the female, was developed by the scientists at the Central Drug Research Institute CDRI Lucknow in India. Better awareness about sex related matter, increased number of the medically assisted delivery, and the better postnatal care leading to decrease the maternal and infant mortality rate, increased number of the couple with the small family, better detection and the cure of STDs, and overall increased medical facilities for all the sex related problems, etc., all indicate improved reproductive health of the society. Population stabilization and birth control. In last century, all round development in the various fields significantly improved the quality of life of the people. However, increased health facilities along the better living condition had an explosive impact as the growth of population. The world population, which was around 2 billion 2000 million in 1900, rocked to about 6 billion by the 2000 and 7.2 billion in 2011. A similar trend was observed in India too. Our population, which was approximately 350 million at the time of our independence, reached close to the billion mark of the 2000, crossed 1.2 billion in May 2011. A rapid declining death rate, maternal mortality rate, infant mortality rate, as well as increase in number of people in reproducible age are probable reason for this. Though our reproductive child health program, though we should be down population growth rate, it was only marginal. According to 2011 census report, the population growth rate was less than 2%, that is 20 per 1000 per year, a rate at which our population could increase rapidly. Such a alarming growth rate could lead to absolute scarcity of even the basic requirement, that is food, shelter and the clothing. In spite of significant progress made in those areas, therefore, the government was forced to take up the serious measure to check the population growth rate. The most important step to overcome the problem to motivate the smaller family by using the contraceptive method. You might have seen advertisement in the media as well as the poster bills showing a happy couples, two children, slogan "Hum do, hamare do, we two, our two." Many couple, mostly the young urban working, having even adopted it one child norm, statutory raising in the marriageable age, female to 18 years and the male to 21 years, incentive given to the couple with the small family, and two of the other measures taken to tackle the problem. Let us describe some of the commonly used contraceptive methods which prevent unwanted pregnancy. Ideal contraceptives should be user friendly, easily available, effective, reversible with no least side effect. It also should in no way interfere in the sexual drive, desire, or the sexual act of the user. A wide range of the contraceptive methods are presently available in could broadly grouped into the following category, namely natural, traditional, barrier, IUDs, oral contraceptive, injectable, implant and the surgical method. तो ये था हमारा पार्ट 1। आगे के टॉपिक्स हम नेक्स्ट वीडियो में पढ़ेंगे। मिलते हैं नेक्स्ट वीडियो में। आप सभी को समझ आया हो तो प्लीज़ कमेंट सेक्शन में ज़रूर बताइएगा। लाइक कर दीजिए, कमेंट कर दीजिए, शेयर कर दीजिए। थैंक यू सो मच।